When you think about your water breaking, everybody has the image in their mind of Hollywood where you're standing in the middle of a crowded room and pop, your water breaks and it goes everywhere and it's a gargantuan flood and everybody stops and stares at you in horror. The truth is that's not really how it works. In very few cases does the water break before labor actually begins. Usually it's about less than 10%. So I don't think you need to worry about hanging on to the rail in the subway car and your water breaking everywhere. I know that was one of my big fears, but it's probably not going to happen. There are a few different scenarios of your waters breaking though, and one of them is called spontaneous rupture of membranes. And that is when your water breaks all on its own. It could be before labor starts or it could be after labor starts. It could be that you've been having contractions for a few hours, you know things are starting to pick up speed, and that's when your water breaks. And this is probably one of the most common scenarios where you have been experiencing contractions. You do know that this is labor, you're aware of the fact that things are happening and changes are happening, and your waters break. And a couple of things may tip you off that your waters have broken. It could be a gush. It happens. It happens to some women, and you may be surprised. A lot of women describe it as sort of an internal ping, and then there's a gush of water. And if you're not sure, because at this stage of pregnancy, baby might be doing some jumping jacks on your bladder, we recommend putting in a panty liner and lying down for about 10 or 15 minutes and then standing up. If your waters have broken, the water will have pooled while you were lying down, and as you stand up, you'll have a small gush again. And that's a good indication to you that your waters have broken. The other thing that can happen is what we call a slow leak or a trickle. And that could mean that the entire bag of waters hasn't ruptured. What it means is there's a tear somewhere and it's a slow leak. And so you might just get this constant, consistent trickle of water. And remember that your water, when it breaks, it should be clear and odorless or have just a slightly musty odor. If there are any other odors or if the waters aren't clear, it's an indication that you need to see a care provider. But that slow leak just means that when it does rupture completely, you might have that big gush, but for now you are leaking fluid. Another scenario is, I sort of touched upon, is premature rupture of membranes. And what that means is that your waters actually break before labor starts. And what happens then is you have no indication that labor is happening, you don't know that there are changes, and your water just breaks out of nowhere. And this is one of those situations where we're not 100% sure what causes it. We do know that it is more likely to happen if you're GBS positive or if you're engaging in, or if you're gestating multiples. But it doesn't always happen. It's not even common, really, but it is something to know about. And when that happens, generally speaking, your care provider is going to have a timeline of when they would like to see your baby born. And it depends on your care provider what that timeline is. OBs and family doctors tend to be more conservative. They usually like to see baby born by the 24-hour mark. Midwives might be a little more casual or relaxed about what your timeline is. They may give you 24 hours to go into labor rather than 24 hours before your baby is born. So it's really important to check in with your care provider if that happens. And if contractions don't start at some point in that timeline, there will be a discussion about augmenting your labor and getting contractions going so that your baby can be born without risk of infection caused by the ruptured membranes. The last kind of ruptured membranes or waters breaking that I want to talk about is AROM, or artificial rupture of membranes. And this is something that a lot of people want to know about because it's a very common procedure in the hospital when you're giving birth. And this is a way of augmenting labor and helping labor to move forward. And what happens is the OB or the family doctor you're seeing will ask your permission to rupture your bag of membranes, and they will use what looks like a really long crochet hook, and they will break the bag. You won't feel it. It doesn't hurt. but you will feel a gush of the fluid. And what this does is it allows baby's head to come down and be directly on your cervix, and that can help move labor along and give you a faster timeline for meeting your baby. Now, some of the risks of rupturing your membranes artificially are if your baby hasn't engaged yet, then there's a small risk of cord prolapse, and it puts you on a timeline. If you have been really slow getting into labor, then your rupturing the membranes puts you on a clock, and depending on your care provider, that clock may be longer or shorter than otherwise your labor could have been. So those are just two things to keep in mind in terms of rupturing your membranes. And